Today we're going to be talking about Ataxia Telangiectasia, which is a collaboration between my fellow student practical nurses for 1080B pathophysiology. Hi, my name is Sheena Bardago and I'll be talking about the etiology. AT is an inherited gene mutation that affects the cerebral functions. The mutation is found in the ATM or Ataxia Telangiectasia mutated gene, where it's located on the human chromosome 11 out of 23 pairs. ATM is a kinase that serves different functions, which also is recognized in its connection to DNA damage response and the repair of double strand breaks. So, whenever ATM detects broken double stranded DNA, it fixes it. The mutation affects the normal functions of ATM, which causes the inefficiency of repairing whenever ATM is needed. Residual ATM functions also decrease the severeness of an existing disease, which also means the progression is slower.
My name is Ramadeep Kaur, and today I will be talking about signs and symptoms that a person can experience having AT syndrome. There are so many clinical descriptions that a person can face. So, firstly, wobbly gait. Children with AT often start walking at normal age but then fail to improve much from their initial wobbly gait, and often they have problems standing or sitting still and tend to sway slowly from side to side or backwards. Then I'll talk about eye incoordination. People face eye incoordination due to neurological factors. But the telangiectasia do not affect the vision and vision acuity is normal. However, control of eye movement and visual fixation often impaired affecting functions that require fast, accurate eye movements from point to point, for example, reading. Then I will be talking about neuropathological abnormalities. For example, neuronal changes, gliosis, and vascular changes have also been observed in cerebrum, brain stem, and spinal cord. Next, I will be talking about pulmonary manifestations. People can also face chronic lung disease, develops in more than 25% of the people with AT. Lingering cough, chest congestion, or wheeze may be early symptoms of underlying lung disease in person with AT. Next person also can face dysphagia. So dysphagia is basically difficulty in swallowing. Dysphagia is common in AT and typically appears during the second decade of life because of the neurological changes which interfere with the coordination of mouth and pharynx movement necessary for safe and efficient swallowing. Coordination problems involving the mouth may chewing difficult and increased duration of meals. Next, I will talk about orthopedic manifestations. Acquired deformity of the feet is common in people with AT and compounds the difficulty individuals have with walking due to impaired coordination. Some people with AT suffer from bladder or bowel incontinence and results with difficulties with transfer rather than length dependent neuropathy. There are some other manifestations too. Some individuals also go through a period of recurrent vomiting, which appears to be more prevalent in the mornings. Feeding and swallowing may become difficult for the people with AT as they age.
Hi everyone, my name is Vilma Buhat and I will be talking about the diagnosis and prognosis of AT. The diagnosis is based on a detailed clinical evaluation recognizing hallmark symptoms and specialized tests. So first is genetic testing, which is used particularly when there is a family history of AT. In cases where there is no family history, the diagnosis may be delayed. It also detects mutation in the ATM gene, which is the cancer protection gene, appears before symptoms. Recent newborn screening initiatives have enabled earlier detection in infants even before symptoms are evident. Second is protein assays. It measures the level of the ATM protein in the body, and in individuals with AT, ATM protein is undetectable. However, some patients may retain partial ATM gene activity, which is associated with milder symptoms. Last is the magnetic resonance imaging, or MRI. It uses magnetic fields and radio waves to create detailed images of the brain. Cerebral atrophy may not be visible in the MRI scans of young children. It helps diagnose AT by revealing a shrinkage in the cerebellum, which is a part of the brain responsible for coordinating movement. A key and highly specific symptom of AT is the inability to control voluntary eye movement, which can help distinguish it from other similar conditions.
Now I will talk about the treatment. Basically, there is no specific treatment for the AT, but it can be symptom specific. the treatment of AT based in medical management and neurorehabilitation. For example, physical, occupational, speech swallowing therapy, adaptive equipment, and nutritional counseling. There have been some modest improvements in use of medications to help with symptoms like imbalance, uncoordinated movements, and speech difficulties. These medications are offering some relief, helping people manage these challenges a little bit. Supportive interventions include education about the disease, genetic counseling, individual and family counseling, referral to support groups and advocacy groups, and guidance to online resources should always be offered. Symptomatic treatment plays a crucial role in improving the quality of life for the patient, helping them manage their condition and avoid complications that could shorten their life.
So, AT is a progressive condition that worsens over time. Early in childhood, mild symptoms start affecting movement with visible clusters of blood vessels on the skin. As a child grows, cells lose their ability to function properly, increasing symptom severity and eventually leading to immobility. Infections are also common, making individuals with AT more susceptible to cancers like leukemia and lymphoma. Life expectancy varies, but most individuals with AT live into early adulthood, typically around 30 years of age with a median age of 25.
Hi, I'm Anmadi Abraham, and I'll be talking about risk factors that can be affected by a person with who is diagnosed with AT. So, risk factors involve neurological symptoms, cancer and radiosensitivity, and immunological diseases. Neurological symptoms. The daily lives of the patient might be significantly impacted by ataxia and other neurological symptoms. Physical therapy and routine evaluation for any assistant requirements are essential. Preventing problems, including falls, should be one of the primary objectives of these evaluations. Children with motor and cognitive impairments typically need assistance in school too. Cancer and radiosensitivity. Frequent examinations can aid in an early detection of an ovarian and breast cancer, potentially saving lives. Although blood cancer cannot be avoided, they can be detected early by surveillance. Standard cancer treatment should be given to those with AD, but because their cells are more sensitive, some chemotherapy and radiation therapy must be used with caution. Immunological diseases. While inactivated vaccines are generally safe for people with AT, live immunizations may not be advised, especially if patient has low T cell count. Prophylactic antibiotics and intravenous immunoglobulins can help with prolonged life by treating recurrent infections. Lifestyle of a person diagnosed with AT can be difficult. Diagnosing with AT doesn't mean it halts your life. It does mean that you have to live with the syndrome throughout your life. School and learning support. With the help of the newest technologies and personalized education programs, full time assistance, and assertive technology, children with AT can go to school. Speech and writing abilities may be impacted by motor issues, although hearing and cognitive functions are intact. Progress can vary. Even within the same family, each person's AT progresses in a very unique way. Neurological deterioration is unavoidable even with aggressive care. Increasing life expectancy. Previously, a child diagnosed with AT hardly ever made it to maturity. Some people today goes to college, live on their own, and even make it to their 50s. So hope is there. And one thing that we can do is having hope through researches. With certain trials attempting to halt or alter the progression of the disease, research is improving the possibility of longer, higher quality lives for people with AT.
These are our references, and thank you for watching.